I would like to turn to you, if I could, for the first question, and that is, why is there a need, do you think, for comprehensive legislation for an effective public health response to a pandemic? And does this particular pandemic reinforce that need in some way?
Thanks, Warren, and hi, everyone. I'd like to begin by thanking iLegis and UPenn for organizing this extremely timely conversation. In India, we are unfortunately in the midst of the second wave of this pandemic, and I'm sure by now all of you must be aware of the crisis we are in, with 295,000 cases reported today and over 2,000 deaths. This just reinforces the importance of this event. Before I start addressing Warren's question, I'd like to highlight a general caveat that there is no one-size-fits-all solution to this pandemic. Each country has its own unique dynamics. I know our audience today, especially from India, is yearning for answers. However, at the same time, there are certain fundamentals which are key to a pandemic response, and I think today we are here to address these fundamentals. It's also important to be acutely conscious that law, while it plays an important role, it might not have every answer. And any legal reform should proceed side by side with greater political will and greater public investment in healthcare to boost capacity and infrastructure. So, on why is there a need for an appropriate legislation for an effective public health response to a pandemic? There are two big arguments to this why. The first argument is rooted in the principles of civil liberties. The second argument is rooted more in the regulatory function of law. An advantage of having this conversation today, as opposed to when the pandemic had just begun, is that we have witnessed examples from world over as to what happens when there is lack of appropriate legislation for a public health emergency response. Now, as far as civil liberties is concerned, an important function of law is to uphold democratic values while meeting its regulatory function. These principles include transparency, accountability, legitimacy, proportional actions, which are important even during a pandemic. This pandemic has witnessed many of these violations, and in many instances, the reasons can be traced to inappropriate legislations. For instance, during this pandemic, numerous governments have faced charges of exploiting public health and disinformation concerns to stifle free speech and protests. In Malaysia, an 8-month state of national emergency was approved in January, and the authorities just earlier this month introduced longer prison sentences for people accused of spreading pandemic disinformation, sparking concerns that such powers could be used to quash legitimate dissent. In Hong Kong, critics have accused authorities of using the pandemic as a pretext to postpone elections and arrest anti-government protesters. Hundreds have been arrested in Cambodia, India, Thailand, the Philippines, and Indonesia on the grounds of spreading pandemic-related misinformation. While in some countries, authorities have been criticized for using the pandemic to tackle issues not related to the public health at all. For example, in Singapore, the government planned to use its contact tracing app for criminal investigations by police for purposes beyond COVID-19, despite earlier assurances that it would only be used to track the virus. This is a classic instance of what we call function creep. In Australia, the Premier of Western Australia flagged extending state border controls beyond the pandemic to tackle drug smuggling before doing a U-turn in the face of criticism. Other pandemic measures have been condemned as excessively harsh, including Britain's introduction of prison terms of up to 10 years for people who lie about their travel history, which is clearly completely disproportionate. So these are just some examples of civil liberty concerns that have arisen in this pandemic, and laws play a critical role in protecting these civil liberties and fundamental freedoms of citizens. During a pandemic, what is at stake is not only freedoms, but also accountability and the rule of law. It's been more than a year into the global crisis, and governments still continue to enforce lockdowns and other restrictions in response to COVID-19, and often unjustifiably. Now, the normalization of extraordinary pandemic regulations raises concerns about how readily authorities may embrace illiberal responses to future crises. Let's take Philippines, for example. Philippines has one of the world's longest and strictest lockdowns. Undoubtedly, lockdowns have prevented Philippines hospitals from being overwhelmed, but they also constitute what the UN High Commissioner for Human Rights described as a highly militarized response to the pandemic. Appropriate public health emergency laws help us in keeping exactly such powers in check. This pandemic has stressed the importance of authorities to clearly communicate the need and rationale for extraordinary measures, and we need laws to ensure exactly this. Look at South Korea, for example. They've implemented a sophisticated digital contact tracing system way back in 2015 during the outbreak of MERS. And they used an exactly similar technology quite successfully for the present pandemic response. Now, although this raises numerous concerns of privacy violations, their data protection laws prohibit the misuse of data that is collected. Now, while measures such as digital contact tracing and national lockdowns may be the right advancements by a sensible government, a renegade government may abuse some of these privileges as well. And therefore, the checks and balances always need to be there. And that's precisely why we need appropriate legislations during a public health crisis. Now, for the second why of pandemic legislations, that's a bit more obvious. It's the regulatory function. Regulations should clearly define the roles and functions of governments, authorities, and those in power during a pandemic. This helps maintain consistency and ensure certainty. It helps in taking precautionary decisions as opposed to only reactive ones. In an unregulated space, physical, intellectual, or even financial muscle often enables stronger elements to claim a disproportionately large territory of activity and influence, which might divert attention from the actual pandemic response and as a result worsen the public health crisis. Much of what is happening in India right now as we speak, unfortunately, can be attributed to this. And hence, effective legal framework goes towards ensuring that public health emergency preparedness and response plans stand independent of political and economic fluctuations.
Thank you, Kashish. That was a terrific explanation of why there is a need for comprehensive legislation, and also I think how high the stakes can be here.